Then suddenly, our cleaner ran up to me and said there was someone trying to deliver in the bathroom. I was like, bathroom? I had all the confidence and we bettered the child, bettered the placenta. Mother was okay, the baby was okay. I was okay.
know, that is really, it takes a lot of confidence, it takes a lot of maturity as a midwife or as a nurse, as a health personnel. It takes a lot of, and it's going to build your character as a person. Like you said, now you have built your confidence. You can do anything you want to do.
Childbirth is not just about having a healthy baby. What about the mother? We need mothers to nurture their babies.
Health workers, where we share real stories from people behind healthcare. Today's episode is about transformation, not just of patients, but of purpose. I am joined by Maureen, who began her journey as a midwife and now working in public health as a health educator and a health coach. In this conversation, we tend to explore her experience in maternal care, the realities of childbirth, and why she made the shift into helping people living healthier life before they even get or to fall sick. Maureen, you are welcome to the show.
Thank you so much. I appreciate.
Let's begin. Let's start about this is about your story. So we're going to be talking about you today. All right. So just tell us what actually inspired you into going into becoming a midwife.
Okay, I would say from the onset, I wasn't all inspired to becoming a midwife, right? I would say midwifery chose me, nursing chose me, and healthcare chose me, right?
So
So, um, growing up as a child, I grew up amongst nurses. I everything I knew was about healthcare and nurses because while I was growing up, as a baby, I was always with a nurse, right? So I grew up in let's say a base, an effort base, where we had lots of nurses and they'll come, they'll take me to their shift, they'll take me to the hospital. When they are done with their shift, they'll take me back to my mom, right? So I grew up amongst them. I loved everything they were doing and it was just inbuilt, right? So I grew up liking it, knowing it. It was all I knew. So I would say healthcare chose me. Let me put it that
I like
way.
that. So the midwives or the nurses already they saw that this person is one of us. So right from childhood, they started taking you to the hospital and somehow it became part of you. I like that experience. It's wonderful. All right. So
Yeah.
just tell me what's the first experience in the delivery room as a midwife.
Okay, my first experience, I would say it was exciting, right? As a student midwife, where at the labor ward with my colleagues, and when labor fully started, we've been doing the book work, and now it was practical work, right? So I went to
Yeah.
the delivery room with my colleagues. When they saw the whole process, the blood, the baby coming out, they were all feeling dizzy and some were even fainting. But I was amazed. My eyes, they were all wide open. I was excited. I was actually experiencing what I was seeing, right?
Yeah.
I was telling our senior nurse, we call them sisters. Sister, can I do this? Sister, can I do that? She would be like, wait for your turn. But I think they involved me in cleaning the baby, which was really good, right? So I just knew that this is my place when I did not join my other colleagues on the floor. I did not faint or I didn't see, I wasn't busy. So that was like my first experience.
Wow, wow. Actually, that is your place because I know lots of colleagues fainted the first day they see, labor or they see the child coming out. And from your experience, it shows that actually midwifery or nursing chose you because you had, you are very brave and you are very bold to stand up and take it the first time. Most people will just run away. If I tell you my first experience, you laugh because I ran away because I just couldn't stand it. All right,
Yeah.
that's not. So next thing is midwifery is one of the most emotional areas in healthcare. Because you are dealing not just with mother and child, right? So what is the
Yeah.
what is one moment from your time as a midwife that actually stayed with you?
Okay. I would say there was this experience. It was not far back. I think 3 years ago, if I'm not mistaken. I think that was my last shift as um a bedside nurse or a bedside midwife working in the hospital. And that day, I remember packing my things, clearing my locker, and all of that. Then suddenly, our cleaner ran up to me and said there was someone trying to deliver in the bathroom. I was like, bathroom? What? She was like, yeah, so there's no help. Our resident doctor was not around and everything. She was like, please come and save this woman. She's already in the bathroom. She's bleeding and everything. That's a gate man's wife. So I had to go there with limited resources. Obviously, I couldn't touch any other like resources from the clinic, so I had to go with just gloves and minor things I could get. So when I went to the house, to the bathroom, I saw her on the floor. The head was already out, you know. So when I looked down at her, I was like, "Are you okay?" Yes, she said yes, she was fine. And I was like, "Okay, push." She pushed out the baby. I delivered the baby over the mother's abdomen. Then I clamped the cord. Then also did my downward outward traction for the placenta to come out complete, and also looking out for bleeding. I don't know how I had that mind. It was a solo birth, and
Yeah.
it was resources were limited. Everything was
Mhm.
just limited. So I just imagined, when there's this posting they send us to. It's called MSS, right? Mandatory midwifery scheme. They will tell
Yeah.
us, imagine you are in an environment where there's nothing. How would you
Yeah.
survive? You have to work with what you are seeing. So I
Mhm.
imagined myself in that environment, and I started doing what I was supposed to do. I had all the confidence, and we bettered the child, bettered the placenta. Mother was okay, the baby was okay, I was okay, right?
Yeah.
It was
Yeah.
a really crazy
Seriously.
experience, and I loved it.
Honestly, I'm just, I've heard of people giving birth in the car, but when you experience it firsthand, it's a different ball game. And when people start talking about it, you will know that what we do as nurses is you cannot quantify what you do, because you just save not just the mother but the baby's life, right?
Yeah.
And if you are not there, who knows what would have happened? So kudos. I just thank you for saving lives. It's not easy. We don't people take it for granted, but for someone who's in the healthcare, I don't take it for granted. So thank you very much. Now, this experience you just shared with us, I know when you are going home, you might be thinking about it or something. Not like you said, one of the things that stayed with you as a midwife. How has this affected you, personally?
So personally, after that experience, I just realized that I am capable. I can do like literally all things. I can show up when it matters. With the experience built this confidence in me that there's nothing I cannot do, and I can't succeed. I will succeed. The passion is burning, and I know that I need to save this person. So I must succeed. I am capable of doing anything.
Yeah, yeah, I agree with you, 100%. Agree with you, 100%. Because going into labor, going to meet somebody in labor, just yourself, limited resources, no help, no nothing, that is really, it takes a lot of confidence, it takes a lot of maturity as a midwife or as a nurse, as a health personnel. It takes a lot of, and it's going to build your character as a person. Like you said, now you have build your confidence, you can do anything you want to do,
Yeah.
that's a good one. That's a good, I like that. Well done, my dear, well done. So, people often see childbirth as a joyful moment, actually. But sometimes there are some aspects of maternal childbirth that people misunderstand or misunderstood. Can you just tell us what aspect of maternal care that people actually misunderstands?
So, childbirth is not just about the baby, right? A lot
True.
of people misunderstand it that childbirth is just about the baby. The baby should come out healthy, strong, and every other thing. But childbirth is beyond that. It's beyond having a healthy baby. Now, the baby is healthy. Is the mother healthy? Right? So, childbirth, like the mother, most people, they think postpartum is just about 6 weeks and the mother is fine. It's okay, she's good to go. But it's beyond that. Some women take about a year and over a year, 12 months and over, for them to get themselves back, right? So it changes the mother's world. Not everybody can adjust accordingly. Some people stay behind emotionally, mentally, physically, all right? Not to talk about the pain they go through when the uterus is contracting, when they are trying to breastfeed, the cracked nipples. We just say, okay, the baby is okay. You, as a mother, you shouldn't be okay. The mother should not be overlooked because after the baby is born, it awakens different things from the mother. The mother can be predisposed to cardiovascular diseases, right?
True.
A dominant
True.
trait from, let's say, inherited from the mom, from the dad, a lot of things. The body may not be able to adjust back you know. Some people even lose their sanity. Some people go into depression. Some people start running mad. I never even knew that postpartum psychosis was a thing, until I actually saw it firsthand. The mom was already mad and she was in the postpartum ward. I was like, what? So there are a lot of things that could happen and that could go wrong. Suppose childbirth is not just about having a healthy baby. What about the mother? We need mothers to nurture their babies. So these are something. These are the things that we need to look out when we are talking about childbirth, both for maternal and for the child, for the newborn.
Thank you very much. I really appreciate this your in-depth analysis because first of all, we look mostly at the child. Is the child okay? In fact,
Yeah,
you don't know this because most times the attention is paid mostly on the child, like you said, it's just beyond the 6 weeks.
yeah,
Many things can arise: hypertension, the diabetes, the
yeah.
postpartum, the hemorrhages that can still occur, the mental. Recently we had a client who actually had psychosis postpartum, and whenever I look at her, I just feel so bad because it's not her fault, right?
Yes,
Giving life to the world, and people will not understand that it's after this childbirth this thing can result. So most times it's neglected. I thank you for bringing out this point so that people can actually understand that after childbirth, not just about the child, but the mother too should be actually taken care of and looked at. Thank you very much. I think we're going to bring you back in next episode because you are really killing it for me this evening. All right. So let's move for your transition from midwifery to public health. So you started as a clinical as a midwife, you started in the clinic, then you moved to to public health, which you are doing currently right now. At what point do you begin to feel that it's time to make this transition? At what point in your career do you begin to feel that?
I think 4 years after I graduated as a midwife, I needed something broader. I wanted to do more, aside from being in the clinics and everything. I wanted to touch more lives. I wanted to
Yeah,
be seen. I wanted to be heard. And the only way I can achieve that is through public health. Public health is very broad, right?
yeah.
There are different aspects that you can go into. So I needed to go to the field and see real life things, scenarios, not just me being in the clinicals. That's why I went into public health.
All right, thank you very much. Because at some point, everybody wants to, if you are a progress thinker, you really want to move from stage one to stage two, you want to affect the world. And I like that, you want to change your world, you want to expand your horizon and reach many people. That's very good. You know, So you are now working as a public health and as a health coach, as a health educator. Um, what does your role actually involve on a daily basis? What do you do on a daily basis as a health educator?
As a health educator, I do a lot at first as a health coach, right? It
Yeah.
takes lots of patience, commitment to pass knowledge to my I call them members, not clients, right? I call them members because I see them for who they are. So it takes a lot. A lot of people are far behind, and it takes patience for you to meet them at that point. So
Okay.
daily, I have to remind them, you need to do this. We need to do this, not you. So I put myself in the picture so that they will be very comfortable and do it willingly, right? So daily, that's what I do. I talk, I educate, I teach, I cry with them. Whatever they need me to be, I am it for them. So that's my daily routine as a health coach.
Thank you very much. All right. So sometimes we know that not just sometimes behavioral change is very difficult. From
Yeah.
somebody to for what they know before into doing something else. It can be difficult. All right. So why is it so difficult for people to adapt this healthy habit? Even when they know this is right. Why is it? Why is this just so difficult?
Okay, like it is very easy for people to do the wrong thing. I feel like doing something wrong is easier than doing something right. It takes discipline for you to be that person, for you to do the right thing. And a lot
True.
of people, they are not disciplined and they don't want to be disciplined. So I feel that is just it. It's an easier route for everyone to go.
I agree with
Staying in
you.
your couch, staying in your couch all day, looking at the TV, not doing anything, not wanting to do something, right? It's easy.
Yeah, yeah, it's
Yeah.
easy. I agree with you.
Yeah.
But I just came back from 4 days off, and frankly speaking, most 3 days I was on my couch. So so it's easier. Like you said, it's difficult. It takes discipline, like you said, and honestly, I wish we can all be disciplined so that we can live healthier and live longer. All right. So let's continue. So if someone is listening your experience, what are some of the biggest challenges, some of the biggest health challenges facing communities today?
One of the biggest challenges is everybody's mindset, right?
Mm,
Everybody have the wrong perception of healthcare, of health, of you staying healthy, of you like being fine. Everybody has the wrong perception because lately I've been communicating with a lot of people and I'll tell them your blood pressure is I had a member that had a blood pressure of over 200, 210, 130, right? And when I established care with this member, I was like, your blood pressure is high. Could you help me recheck? Can you just recheck? And let's see what the value is saying now. And the member just said, I am not hypertensive. I am not hypertensive. We don't have high blood pressure in my family. Do you understand?
yeah.
And she ended the call. I tried reaching out to this member, right? Or this person again. That can we just start over? Can we talk? She said, please, I don't want to talk to you anymore. You know, the mindset because they feel like once they tell you are hypertensive, it's a bad thing, right? It's terrible. So they
Mm,
just use the spiritual thing. God forbid I'm not hypertensive. They don't know that these diseases can be managed. So if we can actually change the mindset of people, I think healthcare will be better. Because if everybody still believes that the spirituality of all things, the mortality rate is going to be high, very high. So our greatest challenge in healthcare right now is the mindset. We need more people to educate. enlightening. You know, we need more of that. We need more voices, more healthcare practitioners talk about these things. Not just that, also the family members. When every family member is educated, right, we will have reduced mortality rate. So I think that's our biggest challenge in healthcare.
All right, thank you very much. I like that. Mind the battlefield. That is where everything starts, and that is where everything. And I like the fact that you pointed it out, because if we can all change our mindsets, a lot of things about us will change. If
Yes,
we have the mindset that when we wake up in the morning, the first thing I should do is to take a cup of water. Instead
yes,
of going to take a glass of alcohol. That's the mindset. I wake up in the morning. I
yes.
need to go and do some exercises. So this is the mindset we all actually need to change. All right. Thank you very much for that information. Right. If someone is listening and wants to improve their health starting from today, assuming we have listeners, we know people will be listening to this podcast, and what is one change that would have the biggest impact in their life?
Okay, one change, the very important change, transformation starts from your mind, right? If you are ready to transform your health, if you are ready to stay alive, if you are ready to live healthier and happier, right? You need to start from your mind. Then
Okay.
you start hydrating. You see, little steps can bring lots of change. You see, hydration is one
Mm,
thing that is very important. People overlook. Hydration can change your body from your skin, your metabolism, like your kidneys. You will be healthier if we can reduce the rate at which you drink carbonated drinks, right? Some people prefer drinking carbonated drinks than to drink water, right?
I agree with you.
Hydrate.
Yeah.
Start, yeah, start with a cup of water, right? Then you increase to 2 cups. It takes little from small steps to big steps. So your mindset, you have to change your mindset if you want to live healthier and happier. Then you start drinking water. So to my listeners, that is it.
Right.
Hmm.
So this is very, very important. I'm a mental health nurse, and I know that one thing is the mind is very important. No matter
Yeah.
whatever, the mind is very important. And I thank you for re-echoing the fact that we need to change our mindset, and everything starts from the mind. All right. So
Yeah.
let's continue. I know you are big on public health. I see your page. You talk about vitamins, and talk about some of the stages. So tell us about some of your products. Why is it
Okay.
important that we get the product?
Okay. I mean, first and foremost, you need your essential nutrients, right? In Nigeria where I reside, a lot of our staple food is mainly carbohydrates. We have rice, we have yam, right? A lot of people don't include vegetables into their meals. A lot of people overcook when they eventually add the vegetables, right? They overcook the vegetables, so they don't get the main nutrients, the main vitamins from this food, right? So that's why I preach. For me, I prefer you taking lots of vegetables, right? You include, make your food colorful, add carrots, add cabbage, add spinach, into your food. But where you feel that is going to be difficult, you supplement with vitamin supplements appropriately. For each vitamin supplement and micronutrient, there is a daily dosage, right? So you make sure you follow that daily dosage. Okay. So that's why it is important as we age, right? There are a lot of things that depreciate in our bodies. So we need to supplement. We need a balance for us to be healthy. That's where vitamin supplements comes in. And yes, vitamin supplements, they are not bad. They are good when it is taken the right way. So nobody should have the wrong perception that vitamin supplement causes kidney disease, causes liver this, liver that. No, you are taking it wrongly. There are ways you should take these vitamins time of the day matters as well, that you should take this vitamin. Quantity, it matters. If you are not meeting your daily requirement for a certain vitamin, you supplement, which is totally safe, right? And days where you eat your fruits, your vegetables, you know that okay, you've met this required dosage of this particular vitamin. You don't take, you let it be, right? So vitamin supplement, it is not bad. It is a must have, right? So that is it.
Very much. I like this your lesson. I think you say you talk for. I think you talk for a living right now because because this vitamins, this actually vitamins are very important because, like you said, some of the food, most of the food we eat, don't contain some of these vitamins because they are now being over processed, and when we cook
Yeah.
also, and the life is hard right now. People cannot afford some of these vegetables, fruits, and all those things. So why not just supplement so that you can get those things from your supplement if you cannot afford them your food. Thank you very much, Maureen, for that education. All right. Right. So you've moved from delivering babies right now into shaping life. Because right now I feel you're very passionate about this public health, education, life coaching, and all that. So how
Yeah.
has this journey actually shaped how you see healthcare?
Okay. I feel okay, as we were told, healthcare is not merely just um there's a definition WHO gave, right? Not merely
Mm-hmm.
the absence of illnesses and diseases, and it covers, but it's not holistic. That definition to me is not holistic. And healthcare is supposed to be holistic, right? It's
Mm-hmm.
beyond the absence of illnesses. It it covers both emotionally, physically, psychologically, spiritually, right? Healthcare is supposed to be broad and holistic like that. So the truth is that um if we ask this question, it's not completely old, maybe not perfect. Health is not supposed to be perfect. It's one step at a time. We are not meeting health to be perfect. We
Yeah.
don't want to be all perfect. One step at a time, right? You walk towards it.
Yeah.
That's the way I perceive healthcare. You make sure you try that and make sure your today is better than tomorrow.
Yeah.
So that's what healthcare is supposed to be. It's not all supposed to be perfect. So every day when we wake up, we try as much as possible to have a better today than our yesterday.
Oh, this
So we put
is
in the effort.
yeah.
Yes, we put in the work. We put in the effort
Yeah.
mentally, physically, emotionally, spiritually. So healthcare is one step at a time. Then you get to your desired goal. That's how I perceive healthcare.
This is from the public health standpoint. It's one step at a time. I like that. Like I said, maybe we are going to bring it back at some point. So you can educate us more. How your perspective about healthcare because it's different from what people know. That's why I'm very excited that you're here because most time people think you have to be 100%. You have to do this lab test. You have to do this. But one step at a time. Wake up in the morning that thing you're not supposed that thing you didn't do yesterday. Maybe you didn't drink enough water yesterday. Today I'm going to drink enough water. Maybe you didn't rest enough
Yes,
yesterday. Today I'm going to rest enough. Maybe you didn't sleep
yes,
enough. You didn't sleep early today. Just those little things that
yes.
we just need to just I like a perspective actually. It's very, very educating and very eye-opening. All right. So let me ask you this question. What keeps you motivated in this line of work?
Okay, one thing that keeps me really, really motivated is the thank you. I feel better, coach.
Okay?
I feel so much lighter and happier after talking to you, after speaking with you. It
Yeah.
tells me that change is happening, right?
Mm-hmm.
So
Mm-hmm.
I I am very motivated. If change is happening, it keeps me going. It keeps me on my toes, right? I want to do more. I want
Yeah.
to hear more of the thank you. I want to hear more of I feel better. I am doing better. My attitude have changed towards this particular thing. And all thanks to you for being patient with me, making me to adopt this lifestyle, not being so harsh on me, taking my hands and walking one step at a time with me. Those are the things that keeps me motivated. Just as I said, health is step by step, right? We want to meet that achievable goal. It is not a one-time thing. Small baby steps. With small baby steps, we can get to our destination. So that keeps me motivated. Yes, I'm doing the right thing. So that is it.
Thank you very much. I hope you get be motivated so that you can do bigger things, because I want to see you at the bigger stage, so that you can touch as much life as possible. All right. To end the show, we usually ask one final question, So I'll be ending with this. After everything you've experienced as a midwife and what you're currently experiencing as a public health expert, from midwifery to public health, I believe you have seen a lot. You've seen different aspects, healthcare, and you experience different aspects of healthcare. So, one question I want to ask you before we go: what does true health mean to you?
In one word, true health, I would say true health is you not being perfect, right? But you putting in the work to become healthy, like putting in the work to positively to be whole. True health doesn't have to be perfect, but with consistency, putting in the right, doing the right thing to make you whole, that's what I feel true health is.
Thank you very much, Maureen.
Consistent
It's
effort
been a
to
pleasure
be whole.
speaking with you on this episode because we have enlightened us a lot on this episode, and I'm so happy that I have you on this program. All right, thanks for sharing your program. And this conversation has also reminded us that healthcare is not just about treating illnesses, but empowering people to live healthier lives, better lives, and to everyone listening. Now, if this episode actually resonates with you, I will implore you to please share this message to your friends and loved ones. Also, follow us on social media, and also remember, we are going to be bringing you another powerful episode next week with another health worker, maybe a doctor, maybe a nurse, pharmacy, or somebody. But until then, keep listening and watching Diary of Health Work. Be blessed.